when you come into the office, we like to have a consultation. We sit down together, we look at the x-ray, look at how your wisdom teeth are affecting you, and give you recommendations. We go over risks, benefits, alternatives to the procedure. We want to make sure that we're doing the right thing for your situation. You know, there are a few reasons why people need to get their wisdom teeth out. One is there's just not enough room for these teeth to come in, and so as they're growing and developing, they tend to push on the other teeth. That can cause damage on those roots, cavities, infections. Sometimes cysts and tumors can form around teeth like this. So we say when you're young and healthy, it's a good time to get those teeth out of there. Now, a lot of people want to be asleep for this procedure. It tends to make it a better experience. If you decide that you want to be asleep, then the rules for the anesthesia, you can't have anything to eat or drink for 8 hours before surgery, and you have to have someone with you to stay here in the office. If you want to be awake, there are occasional people that want to do it under local anesthesia. Those rules don't apply. But once you get here to the office, we start an IV in your arm. We give you medications through the IV, get you nice and comfortable and asleep. Once you're asleep, we get you numb. So when you wake up from the surgery, which usually lasts about 30 minutes or so, you shouldn't feel any pain. We have you in a recovery room for 20, 30 minutes or so. So the whole process, usually about an hour. Once you look good in recovery, we let you go home. Recovery at home, usually about 3 to 5 days. Day 3 is your peak of pain and swelling. It tapers off after that. So just kind of plan life around that. Give yourself some time to recover. The rare things that can happen, there is a sinus cavity above the upper wisdom teeth. Sometimes we take out those teeth. A hole can be left between the mouth and the sinus. If that happens, we close it up, put some material in there, suture over top of it. Usually that heals up on its own. There are times that it doesn't, though, that may require another procedure to close. On the lower jaw, there's a nerve that runs underneath those roots. Sometimes that nerve can get bumped or bruised by the teeth as we take them out. If that does happen, you can get some tingling or numbness of that lower lip and chin. Usually it's temporary, can be a permanent thing, but the chance of that is low. Broken jaw is also on the list. A lot of people see that. They're very intimidated by that. That's extremely rare. There are some people who are high risk for that, but the majority of people are not. I wouldn't stress too much about that. If that is a high risk for you, we will talk about that. There are some additional procedures that we can offer to help with the recovery process. One is what we call platelet-rich plasma. That is a blood draw when you're asleep. We spin it down, separate the growth factors in the blood called platelet-rich plasma. We take these growth factors, we inject them back into the sites. That helps stimulate faster bone and soft tissue healing in the area. Another is what we call Exparel. Exparel has been great. It's rather new to the market, but it is a long-lasting local anesthetic that I inject around the wisdom teeth sites. That helps keep those areas numb for 2 to 3 days after surgery. It really has been a game changer for wisdom tooth recovery. The goal of the Exparel is to reduce how many opioids you're taking for pain control after surgery. Obviously, we want you to be comfortable as well. Ibuprofen and Tylenol is what we recommend as your main painkillers. With the Exparel is definitely a possibility, and minimize how many opioids you have to take. We usually send you home with a prescription for an opioid, but hopefully you don't even have to use it. That's typically our wisdom tooth process. If you have questions or concerns, please feel free to ask us. We're happy to help you through this process. We know it's not easy, but we're happy to help you through it.